Why kids with scoliosis shouldn't wait for bracing. When scoliosis is diagnosed in a child, many families are told to watch and wait. While monitoring is very important, waiting too long can mean missing the most powerful treatment window. In scoliosis, timing isn't just important, it's everything. It's crucial. Early bracing works because the spine is still growing. Children's spines don't grow slowly and steadily. They grow in spurts. During these spurts, the spine lengthens rapidly, the muscles and ligaments struggle to keep up, and the existing curves can worsen quickly. Progression can happen without pain or obvious symptoms. This is why scoliosis often seems to suddenly get worse. It didn't appear overnight. It progressed during growth. The faster the growth, the higher the risk. Watch and wait. Sounds safe. It sounds easy, but it can be risky during growth. Curves can increase several degrees in just months. Once a curve grows larger, it becomes stiffer. It becomes harder to control and less responsive to bracing. Treatment options narrow as the curve approaches the surgical threshold. Waiting doesn't keep things neutral. Growth keeps moving forward whether the treatment starts or not. The goal isn't to avoid bracing, it's to avoid needing surgery later. It's also to avoid progression. Bracing is usually considered when a curve reaches the moderate range, often around 20 to 25 degrees, when the child is still growing or when there are signs of progression or high risk. Starting earlier often means better in-brace correction. Fewer hours are needed when it comes to brace wear, shorter overall treatment duration, and a better chance of avoiding surgery. Modern 3D braces don't just hold the spine, they guide growth towards better alignment. The brace works with the child's growth, not against it. Success improves with consistent wear, regular follow-ups, combining bracing with scoliosis-specific rehab, and strong family support and education. The team approach is key. If your child has scoliosis, ask about their growth stage and their progression risk. Understand why bracing is or is not being recommended. Don't hesitate to seek a second opinion. Remember, early action keeps options open. Waiting rarely makes bracing easier, but early care often does. Bracing isn't a failure, it's a preventive strategy. When started at the right time, it uses growth to its advantage, it's not a threat. At Scolicare, we help families make informed, timely decisions, guiding children through growth with evidence-based bracing, scoliosis-specific rehab, and close monitoring. When it comes to kids and scoliosis, earlier support leads to better outcomes.